head of BioNTech, the German company that developed the first COVID-19 Pfizer shot, says we'll need new coronavirus vaccines next year. Company co-founder Ugur Sahin reportedly fears that new strains and mutations will emerge that may prove stronger than any booster shots. So, as more South Africans slowly get the vaccine, how likely is such a scenario? Well, vaccine expert and the board chairperson of our Health Products Regulatory Authority, Professor Helen Rees, is live with us now to discuss this possibility. Dr. Rees, will brand new jabs absolutely be necessary in your view?
Well, we don't know that for sure, but I think what we're trying to do is do a bit of sort of scenario planning just in case. Obviously, everyone is now aware of the fact that we've had a lot of new variants developing, and many of the variants that we've seen, particularly the variants of concern, are more resistant to the protective effect of vaccines. They still work, the vaccines still work against the variants, but not as well as against the original Wuhan strain. So that's what we're worried about. And we're more likely to get variants emerging if we continue on this trend of not vaccinating the majority of the people in the African region. The more the virus transmits between people, the more likely we're going to get variants and the more likely that they are going to be resistant to vaccines. So we have to vaccinate more people and quickly.
Is it fair to say that the more people that get vaccinated, the less likely there will be mutations and other strains because it will spread less, or we'll become more immune to those new strains that are floating around?
Well, there's two ways that you can get immunity. One is through vaccination, which is what everyone is encouraging everyone to get. But the other way is through being exposed to the virus, having a natural infection. Now, some people will be aware that they've had COVID infection and they will have antibodies, but many people with COVID infection have mild symptoms or no symptoms, but they will also have antibodies. The problem is we don't know how long is that protection from natural infection. And at the moment, we also don't know how long is the protection you get from vaccination. So these are all things that we're going to have to continue to understand and investigate. But what you were asking about variants emerging, you're quite right. Variants will emerge if the virus continues to circulate, because every time it goes into another body and another person and it continues to replicate in that person, all the time the virus changes. Most changes are not of any concern. But viruses are very clever at adapting to make themselves more effective, and that's what we're worried about. If they adapt to become more resistant to antibodies, that's when we're going to get into trouble with vaccination. We'll need new vaccines.
Doctor, from where you're sitting, can we reach the 70% adult vaccination by year end?
I think that we all recognize that that's incredibly optimistic, but you can see over the weekend with the huge effort with the VUMA effort that we reached many, many more people this weekend than we had done in previous weekends because of reinforcing our efforts. I think, in my view, the majority of people who are not yet getting vaccinated are not the sort of the strong anti-vaxxers who say, absolutely not. They're the people who say, yes, I'll get round to it, or I've got some questions, I'm not sure. That's the majority. And those are the people that we really have to reach out to. And we also know that for some people, just even having transport money to get to a vaccination site is difficult. So we've got to not only reach out to people with the messaging and the reassurance, but we've also got to physically get our vaccination sites to all the people that need it. 70% is very, very ambitious unless we can absolutely up our efforts at the moment. Look, I think if we got to 50%, that would be pretty much of an achievement, but 70% is ambitious. We need to do more.
All right. It sounds like we could possibly be looking at an annual flu shot type vaccination, just scenario and future planning.
That's right. I mean, everyone is globally is speculating on what is going to happen with the virus. Obviously, as protection in the community goes up with antibody levels going up, as I say, through vaccination and through exposure to the virus, we are going to see fewer cases. What we're, the sort of best case scenario is that the COVID-19 virus becomes, if you like, weaker. It doesn't cause such severe disease. It's less transmissible, and it becomes seasonal, a bit like the flu virus, as you're saying. That's the best case scenario. The other scenarios are that it becomes, as we've just said, a variant and more resistant, and possibly, causing, as we saw with Delta, more severe disease. So we're going to have to just watch this and see what happens. But there is a view that says that with time, as protection in the community goes up, that this could become what we call an endemic virus that circulates every year, and which we'll have to have something like a seasonal flu vaccine for.
Prof, last question. A lot of healthcare providers that I've spoken to said they'd really like a J&J booster shot. How viable is that?
Well, the vaccine MAC and the minister and the department are in serious discussion about this now. As you know, J&J is a single dose. It's a good vaccine and it prevents severe disease and hospitalization. But because it's a single dose, the question is, would it be better to have 2 doses of J&J? We know that the J&J single dose still gives protection 8 months out, so we can still see antibodies at a good level. But if we gave a second dose, would that be boosted? And that's what's under discussion. What is being considered is to bring in possibly a second dose. As you know, a lot of healthcare workers in the first instance were enrolled in the Sasonke trial. So we're considering bringing in a second dose there and to evaluate that. But this question of second doses, particularly for J&J as a single dose vaccine, is very much on the cards.
All right, thank you so much, as always, for your input. Professor Helen Rees, vaccine expert and the board chairperson of our Health Products Regulatory Authority. Thank you for your time this morning again.